Magandang hapon po. I am Dr. Maria Rosario Sevilla, and I declare that I have no financial interests in any of the products that will be mentioned in this presentation. These are our learning objectives for this session. Digital health solutions center on the use of information and communications technology to promote wellness and manage health risk and illness. The US FDA divides digital health solutions into these 4 categories, and we will tackle each one in turn. First is health information technology. Bluetooth and wireless devices such as cardiac monitors, ECGs, and even weighing scales have been available for general use for some time and allowed the rapid consolidation of data from multiple sources. So when we talk about health information technology, it simply refers to the shift to digital methods of secure storage and efficient data transfer. Now, one of the best examples of this is the electronic medical record, or EMR, which is intended to track all the information about the patient, his allergies, his diagnostic records, and all prior interventions. Let's consider the case of this 85-year-old patient who wanted a follow-up consultation. He was a known case of symptomatic heart failure and provided this list of maintenance medications. Offhand, the medication list seemed strangely deficient due to the low doses and lack of some guideline-mandated medications for heart failure. Due to the pandemic, he had been lost to follow-up for more than a year, so it would not be easy to remember all his medical details. Without an EMR, one would have to pray that this patient had diligently kept records of his health history for the last decade or so. Fortunately, I had already shifted from paper to digital in 2006, and this is what my EMR looks like on the laptop. A bit complicated, but this allows all my data to become searchable. By simply going over the records of his previous consultations, we were able to track the significant events in Mr. Patient's past and got the answers to the questions regarding his medications. Why was he not on a beta blocker? Apparently because he had several attacks of asthma in 2018. Why was there no ARNI on board? Based on history, he tried it in 2018 but developed severe hypotension and stroked out. Why was he on a DOAC? Well, apparently he's been having persistent AF since 2019. Pulling up all that information allowed us to put Mr. Patient's illness in the proper context and would be very important in making clinical decisions down the line. In fact, patients always appreciate it when they realize that you know more about their medical history than they do. Now let's move on to telehealth and telemedicine. The terms telehealth and telemedicine are often used interchangeably and simply emphasize the point that the parties involved in the health process are in separate locations. Uptake was initially slow due to concerns about technology and privacy, but the pandemic forced the issue, and even the strict privacy policies in the US, which is governed by their Health Insurance Portability and Accountability Act, or HIPAA, were relaxed and allowed physician-patient interactions to be carried out using popular apps, as long as they are non-public facing. Here is a list of the allowed apps under the HIPAA rules, and we would strongly recommend that you engage in consultation only if video technology is used. Visual cues can help ensure that you are understood correctly by the person or persons you are talking to. Also, video conferencing allows you to conduct simple physical examination maneuvers with the help of the patient or the caregiver. Like everyone else, my conversion was fast-tracked by the pandemic. By April 2020, I pivoted from face-to-face clinic to online consultations and had to carefully choose a platform from all the services and vendors that had sprung up like mushrooms. There were only 3 criteria to be met. 1, the service should be secure and private. 2, the platform should be easy to use, not only for me, but more importantly, for the patients. And 3, it should be accessible to all, whether the patients use fiber, cable, or wireless internet at home, or data on their mobiles. After some research, I decided to go with this US-based consultation site, primarily because it was HIPAA compliant, meaning it uses encryption and no patient information is stored. As you can see, the user interface is very simple, and patients do not need to provide any other details except their name when they check in for the appointment. Among other advantages, the Doxy.me site allows you to personalize your waiting room, and this feature never fails to impress the patient. The only caveat when using video conferencing sites like Zoom and Doxy is that they tend to eat up more internet bandwidth. So for patients with limited internet service, we just agree to meet on good old FB Messenger. Just a reminder, if you plan to use any of the social media apps listed earlier, make sure that you set up a separate account so you don't mix your patients with your personal contacts. You should also ensure that your privacy settings are at the strictest level so that you have complete control over what is seen on the page. A plus point for these apps is that most people are already familiar with them, so they are less apprehensive about using them, and it is simple enough for the doctor to use. Just click the video button and call the patient. So going back to our 85-year-old, the family connected to Doxy.me using their phone, and we were able to determine his functional capacity, observed for signs of distress, and even looked for edema in the relevant body parts. Clinical decisions were made, prescriptions were sent, and follow-up visit was scheduled. The patient and his family were satisfied with the encounter and expressed their appreciation of having everything done within the comfort of their own home. Now to the story about wearable devices. Blood pressure, heart rate, ECG, weight, oxygen sats, these are the most common parameters we use to check during consultations. Now we have to rely on the patient and his support circle to measure these for us. Some will have their own digital gadgets, while others will go to the nearest healthcare worker. But now, thanks to nanotechnology and artificial intelligence, medical computers are much smaller, much faster, and devices have become portable and convenient. Several years ago, these handheld ECG gadgets, which produced single lead tracings of about 30 seconds to a maximum of 5 minutes, were quite the rage. But since they were basically event recorders only, these have been superseded by wearable devices. Based on this article published in August 2021, gadgets may be worn in the ears, on the chest as a patch or a strap, on the wrist or on the finger, or as items embedded in clothes and shoes. The question, however, is how do these measure the biomedical parameters of interest? Photoplethysmography is the critical element for biomedical monitoring. PPG uses light to measure changes in the microvascular blood volume, and its various applications include pulse oximetry, beat-to-beat time interval monitoring, and pulse wave measurement. Combining PPG and ECG allows the measurement of pulse transit time, which is the basis for the calculation of cuffless blood pressure. Based on this data from October 2020, only 11 out of 39 applicant devices were cleared by the US FDA as medical monitoring tools. For chest patches, which function like cardiac monitors or Holter units, 6 out of 8 candidates were given the go-ahead. These are mostly disposable units which can record up to a maximum of 30 days, depending on the manufacturer. As far as watches are concerned, there are 13 candidates, but only 4 have been cleared. Specific fitness watches from Apple, Biobeat, Omron, and Fitbit have received FDA clearance as medical monitoring devices. However, the authors of the article warned that accuracy and reliability of all the wearables are not yet well established and will still require further clinical trials before they can go mainstream. Now, these fitness watches are very easy to use and are the most popular of the wearables. However, a price check of these 4 revealed that they range in price from about 10,000 to 25,000 pesos. Still quite a hefty amount and definitely not within reach for the ordinary Filipino. The high cost will also be a major stumbling block to general use and may further aggravate health access disparities. Now, out of curiosity, I did an online search for similar gadgets, specifying ECG as a filter, and discovered 3 other models in the non-US markets, all of which were priced at a fraction of the leading brands. Since these gadgets are mostly made in China, I decided to buy one, and I'm currently taking it on a test run. This watch, which is marketed in Eastern Europe and Africa, combines the best features of the four because it measures ECG, blood pressure, SpO2, and sleep, and has a smartphone app which allows data sharing with others, including the cardiologist. So far, its performance has been comparable to the leading brands, but it does not make any claims regarding medical utility. Of course, it goes without saying that we should not rely on any of these gadgets alone for the diagnosis and management of heart failure, hypertension, or even AF detection. And as trained cardiologists, we should be able to discern the information we need to make the best clinical judgments for our patients. But as the market matures and more of these wearables become available, patients will surely benefit from the elimination of the pain, discomfort, and inconvenience associated with blood pressure and ECG determinations, as well as the convenience of having these and more parameters measured by just one gadget for a very modest price. Now, there are many other devices that are in development, especially in the diagnosis and management of acute decompensated heart failure. There are 3D printed and electronic tattoos which can sense heart rate and ECG data, measure the levels of blood glucose, sodium, and other biomarkers, and even transmit the data across continents. This is a vest which uses remote dielectric sensing technology to quantify lung fluid status, and its performance is supposed to be comparable to the measurements done by the high-resolution CT scan. Now, this is an implantable pulmonary artery pressure sensor that is attached to an implantable cardioverter defibrillator cardiac resynchronization therapy pacemaker and is used for predicting and preventing the onset of congestion. Research continues into voice recognition systems that can detect pulmonary congestion in dialysis patients and risk prediction algorithms which use artificial intelligence to identify heart failure phenotypes and predict heart failure treatment responses. All these are meant to sense the physiologic changes which predict the onset of acute congestion, so that appropriate intervention can be instituted to prevent decompensation and slow down heart failure progression. Now we come to the last element. Mobile health refers to apps that are intended to help patients do self-care maintenance, self-care monitoring, and self-care management. There are many health apps available online, and most will record your vital statistics, diet, and exercise activity. Now, MyFitnessPal does these and more. This app stands out because of its extensive library of analyzed international foods, including Filipino food. As you can see, you can search for foods like pinakbet, or laing, or longanisa, and you will find them on their diet list, complete with breakdown of macronutrients, sodium, and potassium content. Even pandesal has nutrient breakdowns depending on whether you bought it from Pan de Manila or Red Ribbon. So if your patient needs to monitor his salt intake or total calorie count, then MyFitnessPal can make the task easier. I also searched the App Store and the Play Store for specific heart failure apps. Several came up, but most required foreign credentials or prescriptions, so they were basically useless for us. However, while doing the research, I stumbled upon the interview of a founder of Sidekick, which is a product developed by doctors and other health professionals in Iceland and Sweden. Sidekick describes itself as a social health game, much like the Apple Watch and Fitbit apps, where you are awarded flags or medals for reaching milestones and are encouraged to post it on social media. What makes Sidekick different, however, is that this game was developed specifically for disease management and that the reward is more altruistic and eco-friendlier because you choose to donate potable drinking water to children in different parts of the world. Sidekick's management was gracious enough to grant me an interview and shared with me a glimpse of one of their programs. Basically, Sidekick offers a patient program on heart failure, with each module presented as a game or a quiz so that learning is painless. The trials have shown that CHF patients who finished their educational modules showed improved clinical outcomes, better adherence, and increased mental well-being. As a result, Sidekick is now prescribed to patients in the US and Europe, but only in partnership with big pharma and major health insurance providers. So why am I even mentioning them? This sidekick model could serve as an inspiration for the development of a local app intended to provide interactive educational programs for our patients. We have seen how these four elements intertwine in this new paradigm of healthcare delivery. They make possible the connection between physician and patient despite the limitations imposed by disease and distance. Home monitoring of these critical parameters will continue to fuel the researches in cardiovascular care and assume a major role in clinical management. As a result, it will not be difficult to predict that digital determinations of blood pressure, ECG, heart rate, and physical activity will be considered as surrogate endpoints in heart failure research and management in the near future. As for my 85-year-old patient, he and his family have happily adjusted to testing for blood pressure and oxygen saturation using their home digital gadgets, sending photos of their lab results to either FB Messenger or through a G-form to my Google Drive, and talking to their doctor through a video consultation on doxy.me. The next step will be to incorporate the use of affordable tech and finding or designing the ultimate cardiovascular or heart failure app to be shared with our Filipino patients very soon. Computers have dramatically changed the medical landscape, and there is no use resisting its entry into our daily medical practice. As cardiologists, we have the power to care for our chronically ill patients in their own homes without them having to contend with traffic, long-distance travel, or even the prolonged stay in their busy doctor's waiting room. Let's not abdicate our roles as team leader, lest we be replaced by robots in the not-so-distant future. We are at the cusp of this digital revolution in cardiology and heart failure. So let's take the opportunity to ride the wave of innovation and creativity. Maraming salamat po.